So I'm going to turn it over to my friends from Amex Podiatry. We've done a lot with them this year. They have the Liposana product, they have the DPMX product, and they're launching a new product right now. So we're here to learn about that one. And I'm going to turn off my camera and turn off my microphone and turn it over to John to introduce our speakers.
Hey guys, thanks so much for coming out and joining us tonight. As always, it's great to see a lot of friendly faces on here, and thanks to everyone for continuing to support Amex. Tonight we are going to talk about oral BPC 157, a very exciting one, Pep. So that being said, we're going to talk a little bit about our awesome presenters who I think a lot of you guys already know and love. So we have Dr. Sev Reineck. Dr. Reineck is board certified in functional medicine, and he's also certified in peptides, has a tremendous amount of experience with these products. We have our chief medical officer, Dr. Ho Ellsworth, who is board certified in podiatry. She specializes in MIS and regenerative medicine in her Austin-based clinic, Aligned Foot and Ankle. And I am John Zagorski with Amex. So quickly, guys, as I mentioned, we appreciate all of the support for our company. For those who do not know who we are Amex Podiatry. We focus specifically on advanced cash pay modalities for podiatry, and our goal is to help people expand their practices outside of traditional insurance-based models. So right before we get into the fun stuff, we're going to go over the agenda really quickly. So we're going to do a quick introduction to peptides, talk about how peptides can be beneficial in podiatry, why we're so excited about BPC 157 and how it works, specifically applications for podiatry, talk about the Cinepep product itself, and then what I think is going to be really fun is talking about how y'all can effectively incorporate it into your practices. And then Dr. Seb's going to go over some real world examples with us about great patient experiences. Oh, sorry, Anna, I was reading your thing. All right, so we're going to kick it off with Dr. Ho Ellsworth here. So thank you, guys.
Hey, guys, thanks for having me. So, it's like you hear right now, peptides are just the big buzz. And I know that about a year ago, I was kind of, I started like hearing like peptides. And I thought, what is this all about? And started doing my research on it. And then I attended a conference at the ACPPS. And Dr. Sev Reineck did a great lecture breaking down what peptides are and all the different types of peptides and how we can incorporate it into our practice. And so I thought, hey, what better person to present and discuss peptides with us tonight. I'm Dr. Reineck was not only my professor, but my mentor. And so it's kind of really a big honor for you to be on here with us right now, Dr. Reineck. And thanks for joining us.
My pleasure.
But when it comes to peptides, Dr. Reineck, everybody knows what we studied in school, right? There's short chains of amino acids. But when it comes to peptides, like, how does that apply to us in the clinical world? What applications and what is it? What is a peptide and how does it work?
Well, it's kind of a shocking fact I'll mention now is peptides have been used in medicine for over 100 years. The first peptide was insulin, which was incorporated into medical use back in 1921, followed by oxytocin. And very few people know, but the Soviet Union was #1 in producing peptides in the 1940s and 50s. They tried to patent them, and the International Patenting Body would not allow it since amino acids are natural, and you can't patent something that's natural. They tried to do it, but the Soviet Union, which is now Russia, have been using peptides in their medical treatment for 30, 40, 50 years. It's only recently that it's come over to the United States or into North America. We've been using it in our functional medicine clinic here for almost 10 years, and it's been an evolving process. As more peptides are being developed, there's more indications for the use of peptides. And the great thing about it is that they're all natural, and patients do get a massive amount of benefit from having a peptide therapy for their pathology.
great. Yeah, I know. I think especially with all the GLP-1s that are being mentioned, I think, the word peptide, it's like, okay, so for us in podiatry, we're not going to be prescribing GLP-1s, but what I do now in my office is really, I'm trying to create kind of a regenerative center, and anything and everything under that umbrella from, shockwave laser therapy, red light therapy, class 4 laser therapy. And I feel like with peptides, it really fits so well under that umbrella. And so when we talk about peptides for the pathologies that we face, from like wound, diabetic wounds to soft tissue injuries, soft tissue, chronic, inflammatory conditions, and diabetic neuropathy, you've been prescribing peptides like crazy in your practice. So what are the applications you see that fit here in the podiatry space?
Well, number one, there's about 40 different peptides out there that are beneficial for patients of all different types of pathology. As far as podiatry specific is concerned, any soft tissue problem, peptides will have an amazing benefit for. Patients who have wounds, we treat a lot of wound care patients not by applications on top of the wound. When we work in conjunction with the wound care clinics, they send us to patients to do a complete evaluation. We do an 80-panel blood workup, so we do a lot of measurements for C-reactive protein, homocysteine, looking at pregnenolone levels, different hormone levels, et cetera, et cetera. So from a wound care standpoint, we attack from the inside, from the molecular level going out. Then the podiatric physician takes care of the applying whatever product they want to put on top of the wound. That's one of the things. Postoperatively here, using peptides, especially BPC 157, is amazing to shorten the healing time, shortening the swelling that happens for postoperatively. So podiatry is entering a space that, number one, peptides will help tremendously, and number two, the patients will really appreciate it, and number three, there's still a lot of doctors not using it. So from a competitive edge medically, you're going to be a step ahead of everybody else using peptides.
So you kind of already answered my question, I think, here was that, when we went over the list of peptides, it can get really overwhelming, right? And then the names and everything. But really, when I remember my favorite quote from you during your lecture was, if there's any one peptide that can be most applicable in all the different settings of podiatry, that's probably going to be the BPC 157. So I don't know if that's your favorite one, but I know that's really kind of a one that we can really use.
Yeah, it is my favorite. It's number one. Like I would say to when I lecture, that sooner or later they should put it in the drinking water, because there are really no side effects with using BPC 157. It stands for Body Protective Compound 157. It was injectable. Now this company has developed an oral form, which patients love tremendously because they don't have to get needled or come to the office for an injection. There are some pills that have been put out there, but they don't equal to having the substance orally that this company makes. So that would be my number one, followed by about another 20 other ones. But BPC 157 across the board this day and age would be the peptide everybody should be using for all kinds of different pathologies. And again, podiatry specific, it should be part of your everyday armamentum from a pharmacological standpoint. Every podiatric physician should be using peptides in one form or another.
And Dr. Reineck, so I know we're talking about podiatric specific applications today, but there'll be a lot of benefits to the patients outside of their podiatric concerns. So can you speak about some of the other benefits that patients may get by taking BPC 157?
Well, in general, inflammation's a big problem, and the studies in the last 5, 6, 7 years have shown that if your body has any type of inflammation, it's going to impede your immune system. And what's good about BPC 157, it really knocks down the inflammatory markers that the patients have. If you do a measurement, a fine detailed laboratory measurement, you'll see that your inflammatory markers do decrease with a patient on the daily intake of BPC 157. And we're not talking a lot. We're talking maybe a spoonful, which is in one of those packets, 200 to 500 micrograms. So across the board, there's been studies for migraines, for sore throats, for cardiac enlargement, those who have cardiomyopathy. It's been helpful for that. So again, you asked me a general question, and there's not one area that you cannot use BPC 157 in. The only two things you wouldn't be using it in is pregnant women, pregnancy, I shouldn't say pregnant women, pregnancy, and somebody who's immunocompromised.
Yeah, I think that's great, guys. You know, for 42, I'm a pretty battered man. I've had back surgery. I've compound fractured my humerus. I've torn my biceps. So before I started taking this stuff every day, I was pretty sore. So it really does work throughout the body. And we're getting a lot of questions in the chat right now. And I think it's a great question because historically, the absorption with orals has been significantly lower than the injectable. And whenever we talk about this product, that's something that always comes up, is that the orals just aren't as good as the injectables. So Dr. Reineck, I know you've studied this product pretty extensively. You use it a lot. Would you mind talking about
I started, years ago, I started with one company and then I switched over to another company. Well, finally, this company has developed a system. Their system is a controlled pulsatile peptide release system. So you can do a massive oral dose of BPC 157 orally, but it's going to get broken down quickly and it won't really get into your bloodstream as fast as you want it to get into. This company has developed a system where it slowly gets absorbed and slowly pulsates. Means every 20 minutes to 40 minutes, it'll peak a little bit to stimulate the receptors. Because you don't want to overstimulate the receptors, they'll get shut down, and then the BPC, the peptide, is being wasted. So by this company developing the system here, it's changed peptide science greatly. And I think the other companies are going to probably copy their system, copy their delivery method, or develop one of their own. So what separates BPC 157 from the other companies, and again, there's many companies out there that make it. You always have to check if they're third-party tested. You got to check their backgrounds because, some companies make it in the garage, make it in their basement and try to sell it. You have to be careful with those. But this company with its controlled pulsatile release system made all the difference for the patients. It's basically in a nutshell.
That's perfect. And usually we save questions to the end, but it feels appropriate right now. So in your patients, Dr. Reineck, has this been, because I know you were doing a lot of the injectables before, so in your patients, has this been as effective as the injection?
Now with this release system, it's almost as effective as direct injection. Doing an IM or even a sub-Q abdominally, the oral system that they've developed here it's the same. It's the same. There's no different. And we've had enough patients, over 1,000 in the last 5 years, that we've done different peptides. IM injectable, a sub-Q injectable. Now we got the oral that is with this delivery system made all the difference. And patients, some do have needle phobia and some don't want to come in once a week for an injection, or they don't want to do it themselves at home. So this came at the right time a few years ago. And again, I use this company. It's not a conflict of interest. I'm telling everybody this is the company I use because of what they've developed, which gives the patients the greatest benefit.
Perfect. All right, Dr. Ho, we're going to kick this back over to you.
So I think for what we do, I love that this fits right into already the flow of my clinic. There's no interruption, right? From everything we offer, from class 4 laser therapy to shockwave therapy, all of these things continue to promote angiogenesis and collagen synthesis and reduces inflammation, and then promotes and recruits, growth factors to the areas and the areas that have pathology or need the repair. So I feel like BPC 157 works very well in this regard. So it fits well under this entire category of regenerative therapies. Don't you agree, Dr. Reineck?
Absolutely. Absolutely.
And so I think it really doesn't. And I think for me, to make the therapy that I offer my patients kind of that continuum of kind of comprehensive care, I tell them that, hey, we're going to do this in the clinic, but what I want you to do is continue this at home. So this is a way to offer the patients what they can do day to day at home so that they can get the most out of the treatment that you're getting in the office. Let's talk about the clinical applications of BPC 157 from everything from surgical to bone healing. What exactly, if you don't mind not getting too much into details, but what exactly, how does it work in these areas, Dr. Reineck?
Well, from a podiatric standpoint, I guess, again, any soft tissue injury, Achilles tendon injury, a simple ankle sprain, a high ankle sprain, your plantar fasciitis, just oral doses. After the third oral dose, I'd say 90% of the patients will come back and say they have such great relief. And again, because it's reducing inflammation and swelling, it really modulates the cytokine activity, your TNF alpha factors that cause a lot of swelling in the body, especially in joint areas. Priceless. I can't say much more about it. And bringing you blood vessels and blood flow to the area to reduce the inflammation, reducing the pain. Again, right now it's the gold standard. And if you go to these peptide courses, they're going to talk about BPC 157 as the gold standard because they still to date have not found something negative about it. And that's the key. So that's the key, that the pharmaceutical industry hates it because they can't patent it. So they try to block it by going through Congress and saying you can't use peptides. They'll block one, that'll come back on the market 6 months later. Then they'll block another one, then it comes back on the market 6 months later. These are the things we have to deal with sometimes in the States with the FDA. But again, something that works always is going to be somebody out there who wants to take control. As far as bone healing is concerned, I mean, for osteotomies, it's fantastic. The oral is fantastic to help fibroblasts, especially for the wound healing. Those who do total nails will find out that the healing aspect is just so much greater. A PNA that you do that might take 10 days to heal up will heal up in 2 to 3 days. And you'll see the results and you won't believe it. You'll think this is rare or this patient's just a good healer. It's not just the patient. It's actually the peptide that's doing all the work.
So when it comes to, like, we see a range of pathologies. So there's no contraindications in someone who's got, for example, like rheumatological conditions or diabetes. So, and then what about contraindications or drug-to-drug interactions? Are there any interactions with other drugs that
Nope.
patients are taking?
Natural amino acids, short chain, about 4. Well, PPC is a decapentapeptide, so it's 15 amino acids. Not big at all, but very powerful and strong in signaling. I mean, it's a signaling molecule, it's a hormone, it's a neurotransmitter. This peptide can do a lot of things that medications can't do.
Okay. And Mark
Prescription
Foreman asked a good question, like biologics, like Enbrel and Taltz and, methotrexate, all those medications, any issues with patients while they're on that?
Not to date. Not to date that I've been aware of. When we've been doing, our functional medicine clinic going on 20 years, we haven't had a cross reaction with anything.
Okay. All right, great.
So guys, I have a quick question since you brought it up, Dr. Reineck. You were talking about FDA and we get questions around the legality of this product. I know if the product's an injectable, it has to be regulated by the FDA as a drug or biologic. So that brings on some more challenges. But when you have a product like the Cinepep oral that is a dietary supplement, can you talk to the folks a little bit about just the differences for anybody that may have concerns about using this in their clinic?
Yeah, we always have a consent form, even though it's oral. The consent form, and we have to educate the patient. It's not FDA approved, but it really doesn't have to be FDA approved. It's an oral supplement, as you said, an oral supplement like a vitamin almost, but they still have a consent form that they have to sign, knowing that this is almost like an off-label use of something. We go through the steps, what it does, why we're using it, how long we've been using it. And again, we bring up that the doctors in our clinic are all certified. A lot of doctors out there are saying, well, we use peptides, I'm a peptide expert, which is okay to say. But if it comes down to a court case, and I'll put my lawyer hat on, I'm going to look through the chart and say, you dispensed BPC 157. What did you know about it? Do you have any certifications? Are you board certified? And you can't sit there in court because the lawyers will pick through the charts, find everything out. So having a consent form is great to have, but also to have is a little bit of a certification to back up your knowledge that you're telling these patients, I'm certified. Here's my consent form. I've been using it on patients for the last X amount of years.
All right, perfect. So before we move on from the last slide, I know we're getting some questions about wound healing. So if somebody has a diabetic foot ulcer, would taking the oral form of BPC, would that be beneficial to a diabetic foot ulcer?
Absolutely. And again, for our patients here that do come in with, say sub-second meta-head diabetic ulcerations, we would put them on oral BPC 157 the first 7 days, twice a day, morning and evening. Then we titrate them down to once every day, and then by the third week, every other day, because we want to give the receptors a little bit of a break. But again, it depends on their the type of wound they have, and also any other comorbidities the patient may have. So again, every patient's a little bit how you adjust them. They all get the BPC, and again, it's a blanket statement, a lot of it anecdotal, but for ulceration, for wound healing, it's tremendous.
Fantastic. So, Dr. Ho, I know this is a product that you're really excited about. You're just bringing it into your clinic as of recently. We thought it would be a good idea to have a little session about how you guys are talking about this product to your patients.
Yeah, I think, I think if you aren't already incorporating some sort of regenerative therapy in your clinic, you're going to start looking pretty outdated. And I think that, I feel like all these products really just completely advance what it is we're already offering in podiatry. So I'm really, really excited about this. And the way I pose a lot of these treatment modalities for my patients is that, when they're investing in a treatment in your office, it's an investment, right? Because a lot of these modalities are not covered by insurance. And so I tell them that, I want to continue to make this investment pay off, or continue to bring them relief. So we're going to add on the Cinepep oral BPC 157 as an at-home treatment protocol that they can use and they can do at home to kind of perpetuate the effects of what we're doing for them already. And so that's my plan. This is a great product that, I store it, and you store it in the fridge. You dispense it to the patient. You sell it as a 30-day monthly treatment. And I think it's going to be a really effective way. My analogy for a lot of these things is it's like if you go to the gym and you work with a personal trainer, your work isn't done at the gym. And so, whether you see them for a day or 2 days, you have to do the homework and you have to continue at home. And so this is what the patients can do on their part. And, from what I do, from minimally invasive surgery to treating a lot of chronic conditions or sports injuries, from a regenerative standpoint, it's really important to incorporate these non-invasive, doesn't require needles. It's a very, very good viable option for us to introduce into our clinic.
All right, Dr. Ho. Yeah, I know that this is something that you talk about often, and I think creating combination packages for patients is awesome. And I think that I'd love for you to talk a little bit more about how you see incorporating the BPC 157 monthly application along with some of the other things that you're currently doing.
Yeah, I think if we pose ourselves as a consumer, I know for me, when I look at a product that's got several things going on, I always think, okay, I'm a little overwhelmed. Do I get this, this, and this? But if I look and somebody's got a combination package, I'm going to say, okay, this is easy. I can handle this, and this is what I want. I feel like I'm getting the complete package. So I think it's really important that we pose our therapies in the same manner, and presenting it as a package therapy. Not only does it offer a sense of value for your patient, but also it offers it as a way that they can kind of get the complete comprehensive kit. And so this is something I'm going to plan to incorporate in with my modalities I'm already offering. And typically I bundle packages, whether it's shockwave and laser therapy, along with products like DPMX injection. This falls right under it. For example, my MIS surgeries right now, you know, this is going to be something I'm going to have my patients start on before surgery, continue throughout surgery, and then during surgery, and then complete afterwards, to make sure that from before to after, their body is primed for healing and reducing inflammation for the patient. So I think it's going to be a very, very easy product to combine without interrupting your current flow.
And
I
for,
think
if I may jump in, if I can jump
Oh,
in,
sorry.
talk about combination packages, also not in this webinar, but in the certification course, we do combine peptides with other peptides. A lot of times BPC 157 is combined with another peptide, which is called TB 500, which is a synthetic form of thymosin beta 4. That also helps healing because TB 500 affects the actin. It's a protein important in cell structure and movement. So for most patients, just for clarity, again, we're not getting into it tonight. So you get BPC 157 and you get some TB 500 to get excellent results.
Awesome. Thank you. So before we jump into some questions here, guys, there are a lot of them. So we appreciate everybody's interest. Like Dr. Sev was saying, he has used this Cinepep BPC product extensively. So I thought it'd be a good idea for us to finish up here with just him talking about some real world success stories.
Again, the real world success stories are across the board. Patient just coming in with heel pain, and you're going to look for your heel spur, plantar fasciitis, biomechanical difficulties. Before I even start any prednisone or start any medical dose pack, we always give the patient a week's supply of just the BPC 157, and by day 3 or 4, the pain will be resolved at least 50%. Now, the problem is this. We don't want to keep them on it for months and months because, again, it's a little bit costly sometimes for the BPC 157, but it works great, and we've passed that barrier. Patients don't mind paying when they get the relief. It worked great for plantar fasciitis, for post-op healing, osteotomy patients, first metatarsal osteotomy patients. It really reduces the swelling and the edema associated post-operatively. We see those. So we get patients sent to us to our functional medicine clinic from all different types of specialists. Our pain management guys that send us to patients with the low back pain, that's pretty much where we use BPC 157 and TB 500 to reduce inflammation down. I mean, they might be bone on bone L4, L5, but the inflammation and the strangulation of those peripheral nerves that's sending the pain signal to the brain, we get the inflammation under control. So even though they might be bone on bone at L4, L5, they just don't have as much pain. So again, it does go across the board. Dentists sent us their dental pain patients post wisdom tooth extraction. We put them on BPC, and again, keeps the swelling down, keeps the pain down. So again, real world examples go all across the board.
Yeah, would you mind talking a little bit about the first responders that you treat with this product? Just because I think that's something super awesome that you do, and those are the guys that probably need it the most.
In the functional medicine clinic, we take care of a lot of Chicago police and Chicago firemen. And again, they're running, they're jumping, they're climbing ladders, and of course, they're all work out to try to stay in shape. And we have half the Chicago police force and fire department on BPC 157 because it eliminates their pain, it gets the swelling down. We've tried some patients the past year with fibromyalgia. We've gotten results are not bad at all. I'm trying to publish a paper about that coming up next year, but I need at least another 20 patients to get into the study. So again, across the board, we don't use it on kids. Okay, got to be 18 and over. Again, it's because the concentrations in the plasma aren't really ascertained in the pediatric population, so we keep it mostly to the adult population.
All right, fantastic. Those are some great examples there. So I think in a moment here, I know you guys were asking about pricing. So as of now, it's a 10 30-day supplies for $800. And if you order with your first order, we'll include an extra box so you can have a month supply for yourself as well. This does include shipping. Like Dr. Ho said, this does have to be stored refrigerated, and we do supply these nice little boxes to send the product home to your patients in. So with that being said, we have my contact information here here, let's get into the questions first.
Hey, John,
Sorry, I was static.
just to clarify also real quick that we do store it in the refrigerator, but once you give it to the patient, they just, as long as they keep it in the refrigerator within the next 2 days, as long as it's above 77 degrees, right? Or wait,
Below 77, yeah.
Below
Texas is
77.
over 77. We
below
need to get below
77
that. Yeah.
degrees for the next 2 days, you're good. So as long as you bring it into an air conditioned, a space or whatever, and then get it home in a fridge, I think you're fine. But I think just wanted to clarify that real quick.
Yeah,
too.
basically, we just don't want people leaving it in their hot car. They can take it from your office, take it to wherever they're going whenever they get home, stored in the refrigerator. So, Anne, would you like to pop back on here and go through the questions with us?
Yes, I am here. The chat and the Q&A are blowing up, and I honestly don't know where to start. So forgive me if I ask a question you've already answered. I'm going to start with the Q&A box because that's easier for my mind to handle. So here we go. Let's start from the bottom and mix things up. Any use with CRPS patients?
I haven't.
Yeah, but I don't see why you couldn't.
Right.
All right, good. That was an easy one. Can you repeat the dose and the frequency?
Yeah, so it comes in 500 micrograms. So it comes in a little packet like this, and it's taken in the morning on an empty stomach.
Super. Should patients stop NSAIDs while taking BPC 157?
Actually, you should take it because it helps coat the stomach. So if you're on an NSAID, you should be taking BPC 157.
Patients can order BPC 157 directly from online pharmacies. How do you price yours, and what's the ROI? I know you kind of gave us an idea of the pricing, but what would physicians charge?
I think anywhere between 150 to 160. So you're right now, if what they're offering is $800, you're basically getting 300 sachets. And so that's 30 sachets, which is like a 30-day or 1 month supply. And I think it's reasonable to offer it as anywhere between 150 to 160.
What are the key terms, phrases, in your off-label consent for when using peptides? And is it chemical specific or general for any peptides?
It's general for any peptide. Because remember, a peptide is an amino acid. So it doesn't matter if it's Sermorelin, gonadorelin, BPC 157, they're all amino acid peptides. So it's general.
All right. And any key terms and phrases that's in your consent that you'd like to share?
Yeah, but this is not an FDA-approved product. It's an amino acid. We explained to them what amino acid is and what proteins are in our consent form, that they're familiar with it. And it's the key phrases. No, we just try to make it general so the lawyers can't pick at it. Once you get specific, lawyers like to pick things apart.
Well, the beauty of this product is you're not going to need a consent form, right? I mean, this is a dietary supplement. I mean, correct me if I'm wrong, but.
Personally, just because of a litigious society, it wouldn't help to have, and I can send it, we're going to present it at the seminar, the different types of consent forms are used for using a peptide. So an informed consent to a patient can never hurt because you never know what can happen. It's the old saying that the patient who brings you cookies, who loves you, could be the one suing you the next day. All right, so you got to kind of protect yourself.
True.
How long do the doses last? How long does a patient with a wound need to stay on the peptide?
So I think that's really just dependent on the severity of the wound. The nice thing about the release mechanism in this product is it doesn't have a short half-life like the injectable. So like Dr. Reineck was saying, because of its pulsating effect, you're going to continue to have this product dosed between 24 and 48 hours. But we do recommend taking this every day, though. And I think just like everything else with all of our treatments, wounds are different all of the time. So a lot of that's going to have to do with your wound care that you're doing in the office as well.
And in general, what we do is it's 30 days, and then after the 30 days, you take a 7-day break to reset the receptors, then you put them on for another 30 days. And that goes for mostly all the peptides. Some are 3 times a week. Our Simorlin, which stimulates growth hormone, patient takes it Monday through Friday. They take Saturday and Sunday off. Gonadorelin, another one, they just do Monday, Wednesday, and Friday. So it depends on the signaling effect. There's, even though it's just a short chain of amino acids, they do have a profound effect at the molecular level. And so the studies up to date have shown that too much may be not good. So they already have systems down, algorithms down. This one 3 times a week, this one twice a week, this one you can take every day. So these are the things we'll probably cover in the seminar.
Yeah, so I think this
Is
is
it
a
FDA approved?
No.
keep in mind to
Sorry,
be
John, I cut you
FDA
off.
approved,
What's
you
that?
have to be, but I think to be FDA approved, you have to be a biologic or a drug when you're talking about injectables. So it's a really big gray area. But if you guys notice right now, if you're on social media, all of your favorite influencers are promoting the various different peptides, the oral peptides, all the Nuevas out there. There's all kinds of people that are promoting the oral BPC 157 because it's a dietary supplement. You don't have the same regulations. That's not to say you shouldn't be safe, like Dr. Sev is saying, but it's a very gray area with the orals right now. Anything that's FDA approved has to have specific indications, and this product is not. Just like if you guys are familiar with using our DPMX product, that's not an FDA approved product, but it's an FDA registered product. So there's a lot of different pathways that products can be recognized by the FDA. So I know this is a broad question, Doctor. I'm sorry, and I know, sorry, I was just looking at this question. I know this is a broad one, and it's general, but whenever you guys are talking to your patients, how long until somebody should notice results? So when you're saying, hey, you guys are paying for this, you're going to get home, when are you going to start to feel something?
I'm going to defer
Depends on the
that to
patient.
Dr. Ronick.
Yeah. Depends on the patient. Yeah. We tell them this, it's not going to get better tomorrow. All right. It takes time to get into your system. Some people, it takes a little bit longer to get into the system to get the right blood level. Some people, it gets quicker. So it's never, we never tell them in 3 days, you're going to feel like 100%. All right. Give us a call when you feel better. They all feel
Call
better.
us when you feel better. I like that. Call us when you feel better.
That's the thing about it is that people take an ibuprofen, people take a steroid, and immediately they see the results, right? And so whenever I pose these modalities or treatments to patients, I always say, listen, we can either mask the pain, which is NSAIDs and steroids, or we can heal the pain. And we all know it takes time to heal. So what we're doing is we're supplying the body with everything it needs to try to heal it. And healing, your body's healing potential is unpredictable. Everybody's different. You know, what the comorbidities they might have compared to another patient, it really varies vastly. And so, but I think the best way to explain it to a patient is we can either mask the pain or we can either heal it. And if they choose to, and I've never had a patient who says, I want to mask pain, I don't want to heal it, right? So everybody who wants, to heal the pain, I'm just going to say, well, healing takes time. But what we're doing now, we're priming the body, we're giving it everything it needs to try to heal it.
A couple questions in here about dosing. Is there a standard dosing? And if they have questions on dosing, who would they contact?
Yeah, for sure. You can definitely contact us. I think this is what makes the product so much easier than doing the injectable, because whenever you get an injectable product, the patients have to reconstitute it. You have to think about how much you're going to be administering. With this product, you're getting 500 micrograms of BPC daily. And I would believe that's how Dr. Reinek's telling people to take it every morning. And what the dosing is going to be.
The old days was you'd get 2 vials. One vial would have the powdered form, of BPC 157. The other vial would be bacteriostatic water. Excuse me. You'd have to draw out 5.5 mils of the water, gently put it into the powder. If you do it with force and you shake it too much, you break apart the peptide, because that's how unsteady, or I should say, how they're not super strong. Those bonds are strong in theory and in molecular biology, but you shake that bottle too vigorously, you're going to break it all apart. It's going to be useless. So this oral form is heaven sent, because that's the last thing you want is patients mixing and injecting and spilling and trying to draw up 10 units in an insulin syringe. It was a little bit of a headache years ago.
Yeah, my plan is just to, to substitute any injectable form with this. Because I feel like, if you compare, injectable BPC to products like DPMX, the results I have found to be very short lasting. And they do have to come in and get multiple injections to get this, full effects or some sort of, longer lasting effect. But in this case, my plan is to kind of get away from the injectable BPCs and substitute with the oral.
How are you
How
monitoring and objectifying the effects?
How are you feeling?
Yeah, I think like Dr. Reineck was saying, every patient's different. So once they start taking it, somebody may feel the effects in 3 days. Somebody may feel it in 10 days. But I think that's kind of regenerative medicine as a whole. Dr. Hill, I know whenever you use our regenerative implantable product DPMX a lot, it's probably a very similar conversation.
Yeah.
Same thing with PRP
Yeah.
stem cells that we do. Some people feel great in a couple of days, some it takes them a little bit longer, but we never give them a time period.
Yeah,
It's a good question. If you're going to do a paper, you want that in your paper, but as of right now, stem cells, PRP, peptides, everybody, it's better at a different time length.
So we have one more question, and then I want the doctors to talk about something very exciting here. But question is this being used by longevity experts? And I would say that's probably you, right, Dr. Sev? So I'd say the answer is yes.
Yeah, and just to let you know, when we started going to the anti-aging conferences of 2012, which is 13 years ago, there was about 400 doctors that come to Vegas. Now every year they have the anti-aging conference, the second week in December, and about 6,000 doctors come. So you can see at 10 years the change. The conference is called A4M, Anti-Aging Medicine.
Yeah, you know what? Dr. Reineck was my professor over 15 years ago. He hasn't changed a bit. So I know he's doing something right. It's working.
Thanks.
Yeah, I agree. So, all right, guys, you have my contact information there. If you guys have any questions, please feel free to call, text, email, whatever makes you happy. And I know Dr. Sev and Dr. Twee have a pretty exciting announcement to make here to end the presentation.
Yeah, I am like super excited about this, that we're putting together a regenerative medicine conference. I think we're offering everything from hands-on labs, how to inject products like DPMX and Liposana. And then we've got great speakers that are experienced in the field of regenerative medicine. And then obviously Dr. Sev's expertise on all things anti-aging, regenerative, and peptides. So I'm super excited about that. And
it is certification, correct? We're going to get certified in it. So this way you have a credential, you get certified. We're a recognized body, the American College of Podiatric Physicians and Surgeons, recognized body. We have our the right legality, the legal structure. So you come for the 2 days. At the end, it's a short little test. Everybody passes, but you become certified and you get your diploma, your little certificate.
I know that the first time we announced this was this weekend at the Chicago Medicine and Economics Conference that the ACPPS put on, and we had about 20 some people sign up interested. And so I know we are capping this. I think for the very first one, we are going to cap it to about 50, right, Dr. Reineck?
Yeah, 50 tops.
Yeah, just so that we can kind of really kind of keep it a little bit more intimate so it's not overwhelming. So I think it is going to be a first come, first serve. And so if you are interested, We've got this scheduled right now on October 18th and 19th. I don't know, is the location still TBD, or can we announce it? I don't know.
We'll be sending out an email here by the end of this week, maybe even tomorrow morning, with the website to register, with the exact location and things like that.
Yeah, I'm excited. I did a podcast yesterday with Dr. Rahul Desai, who is the CMO of the Red light therapy, and he's going to make it out, and he's going to show us how to use ultrasound, because he's a interventional musculoskeletal expert, and he is going to show us how to even using ultrasound diagnostic, just to like demonstrate, for example, like doing the Mulder's click and seeing that neuroma pop up and down on ultrasound. And he's going to be there. He's going to talk about how he's been doing, all these regenerative stem cell products for a lot of things, from OCD lesions to all types of chronic soft tissue pathology. So I'm really, really excited about the panel we're putting together for this.
Yeah, guys, and just so you know, this is going to be capped at 50. We want it to be a very hands-on event. We're going to have a lot of breakout workshops and things like that. So we will be limiting this to 50 guests. Brian, I don't think there's going to be an online option for this one, because like I said, this is going to be a highly interactive 2 days. And see, it's hard to scan a screenshot. We will make sure that Anne's able to send out an email to everybody that's on this call if you guys are interested in attending.
Yeah, there's a few other questions in the Q&A. A few questions about, are there any studies or articles or randomly controlled trials that you guys can cite?
There's a
Dr.
lot.
Scott,
There's a lot of trials.
Yeah.
Do you want to compile that and maybe send it as an attachment, as an email or something?
Yeah, mostly in animal models, just so you know.
But I'm really excited. I think that, like, when I talk to people about, regenerative therapy, it is such an exciting, I couldn't be more excited about being in podiatry right now. I feel like we are literally on the cusp of taking off on these modalities. And I think it's so important that you start incorporating all of these modalities into your clinic to stand out in a sea of traditional practitioners. And so, and so I think, open your minds and get ready. Let's go.
And to keep in mind, podiatry's got to jump into this, because I just lectured in March to the Chiropractic Association for the same thing, regenerative medicine. They had over 250 doctors show up. So the chiropractors, when they see something they can help their patient and monetize it, they're the first to try it. Podiatry's kind of been in the background with this, but it's good to see that there's interest, because this is the wave of the future for medicine.
100%.
Well, guys, thank you so much for joining. Thank you, Dr. Ho and Dr. Reineck. Great information as always. And thank you for getting this all set up for us. And that being said, guys, reach out if you have any questions at all. I see Paul, our scientist, actually has his camera on down there in the corner. He's showing our face. So for all of you guys who want to know the brains behind the Cinepep product, there's Mr. Paul right there joining us. So wave, Paul. All right, guys. Well, thanks so much, everybody, for joining. And like I said, call, text, email if you guys have any questions, and looking forward to hearing from y'all. Thanks so much, guys.
Thanks, everybody. Good
Thank you.
night.